We are back with Dr. Caldeira. For those days when you don't feel like getting up
Yeah.
to do what you have to do, who or what gets you out of that mindset?
Music.
Ah,
Yeah.
do you have a particular type of music you like?
The music, of home. So
Yes.
soca music will get me back
Soca
my
music.
energy. If I am low in energy, my calypso, the soca, and generally any music from, my heritage, so African music, will also do the same thing. Yeah. So music will get me my energy back and I will be ready to go.
Describe a case
Yes.
that left you sort of, well, I mean, if it happened, that left you drained. You don't have to give details, but has that ever happened to you where you had a case
Yes.
and when you finished, you were like drained, looking for some source of replenishment? Has that ever happened?
Lots of times.
Oh my God.
Yes, that happens when, people are presenting with significant difficulties in managing their symptoms. And so what was the last part of the question?
The last part of the question
Yeah.
is how do you recover from that? Like,
Oh, you wanted a
Yeah.
presentation of a case. So one of the difficulties, ethically and also for privacy reasons, even if you don't identify the name or age of a patient, ethically and also, as I said, for privacy reasons, it's not a good
Right.
idea to talk about a case unless you've already discussed it with the patient. So especially if it's a current patient, but also the same rules apply for patients you've worked with in the past, that the idea is that one of the important factors that make therapy work is the idea that you can come and talk to this professional in complete confidence, and that when you share your information, you know that it is confidential, so that there are only really 2 times when you are allowed to break confidentiality: when the person is presenting as with ideas or intentions of harming themselves or others.
What is the most humbling experience you've had as a psychologist?
The most humbling. There's so many
Or one of
that
them.
really. Well, I guess I could say a recent, or any where I've gotten feedback that what I'm doing is really helping that person not only cope, but now really thrive.
And what did that experience teach you?
That, one of the things that is a continuous challenge is helping that person realize that they're also working hard, right? Like, just like I'm working hard, that they're also working hard.
You mentioned so many breakthroughs in your field,
Yes.
but I feel almost awkward asking this question, but what are your deepest concerns about your field?
That we continue in some ways to place a lot of emphasis on the disease model. That what I would like to see is that equal emphasis is paid both to the disease model and also to a model where we're doing research on how strengths, how to evaluate people's strengths, how to then design interventions where people are effectively using their strengths to increase their happiness and well-being. One of the things, so a good example is that you go back to my work with trauma and people who have experienced trauma. What we know is that almost everyone will have some symptoms after the event, but that only really about 8% approximately will develop significant symptoms and then develop a disorder named post-traumatic stress disorder. So what I'd like to see is emphasis on how we evaluate and treat what's going on with the person who has developed a disorder, but also emphasis equally on how did people, almost 90% of people who managed to recover quickly and did not develop the disorder or more serious symptoms, how do they cope? What can they teach us? And so I'd like to see equal emphasis there.
After 15 years in psychology, how would you say you have grown as a therapist?
I would say, my increasing confidence in what I do, definitely, and continues to be a challenge as I'm experiencing now, talking about what I do. But I would say that that's been a significant development, being very confident in the things that I've learned and then using that to really effectively help others. Yeah.
In the chat room, Raphael said, "Good evening, Selwyn." Hi, good evening, Raphael. Hi, Dr. Caldeira. Is there a role for psychologists in social justice? With respect to LGBT and society, how can we change the culture of Guyana to be more open to justice?
Absolutely. There's a role for psychologists or, I would say any helping professional, but, collaborating with those who are working on issues of injustice, issues of prejudice, issues of violence towards others. I believe that as a psychologist, we are really equipped on teaching people how to cope with significant events, but also, again, cope with issues that we have difficulty supporting each other.
What common characteristics have you come to recognize when working with women who are sexually abused?
What common characteristics? I would say the sense of losing the ability to trust. Sexual trauma is a very personal trauma, and so the idea of trusting personal interactions, again, is a continuous challenge. A sense of shame, a sense of decrease in self-worth is some of the common things. A sense of being stuck in time, which is a common experience as well, that the event might have happened at this time, but we're now weeks later, months later, years later, having this similar reactions when we're triggered by something that might be similar or hearing stories about similar events.
How does anyone reach your private practice?
Call me, or I'm online as well. And
you can give us your information if you want to.
Oh, great. So my number is 678-748-0430.
Let me type that in the chat room. 678
748
748
0430.
0430.
And my website is www.talkingforwellness.com.
talkingforwellness.com.
Yeah.
Okay.
And I'd be happy to answer any questions people might have about what I do, or, when, how to know when you need a therapist, or when to seek help from a therapist, what, to look for, how to look for a good therapist, how to look for, a licensed mental health professional. I'd be happy to answer any of those questions.
Well, you've just given me an idea.
Yes.
I was telling you this before the show, that I have another program called CWS As It Is.
Yes.
Which starts from 4 to 6:30 p.m. on Sunday afternoons. Not every Sunday for now, but Sundays. And it's divided into segments.
Yes.
So will you be willing to come on one of those segments and perhaps talk about that very topic?
Absolutely.
Awesome.
I'd love to share. I think it's important in, erasing the stigma that a lot of people have about seeking mental health services, that it's important for people like myself to come out and share with the community, how to get help, how to get support. Because the good news is that research has really helped us come up with really effective ways to cope with some of the most difficult situations. And if you're experiencing difficulties coping and it's affecting your love life, your work life, then you should seek the resources that are available to you.
I'm going to ask you this. You mentioned the strength-based approach.
Yes.
If it's not unfair, can you give us 5 things that perhaps a person, or 5 principles a person can use or apply to sort of identifying and utilizing their strengths?
Mm-hmm.
Is that possible tonight?
Well, 5 things. I think that, talking more about...
Am I giving away your book here?
I love that. The 5 things. The great thing about meeting with somebody who is a licensed professional, right, is that they can help you identify your strengths, but also what they can help you do is that your strengths may be right in front of you, but you're not able to see it because you're experiencing a lot of anxiety. You may have had, many stressful events, or one stressful event that, has been difficult to cope with, or, you may also then be able to, with the help of a professional, be able to identify the ways in which you are not using your strengths to the full capacity.
Well,
so those 5 things,
you'll talk about that another time when you come on the show. That's a good topic for a segment.
Okay.
After the 15 years, what have you learned about yourself?
That I'm a pretty bold person.
You are bold.
Yes.
I like that. Are you a workaholic, or have you achieved a good work leisure balance?
It's a challenge. It continues to be a challenge because I have been working actually since I was 15, and in Guyana, my first job was working marking common entrance papers, and so I love to work. I get a lot of reward from working, and it has been a challenge to say no to projects, right? So I would not say that I'm a workaholic, but it is a challenge, a continuous challenge, balancing leisure time with work.
When have you been most satisfied in your life?
I would say probably now, when, I've gotten a chance to really realize what I love most about my career, and
What is that?
also, well, like I said before, in terms of being a clinician,
Okay.
that I realize that I love being a clinician. I like research, but I don't love it, and I love clinical work. The chance to be a mom to my daughter, and the chance to be a partner, a lover, a friend, a husband, to my husband,
Right.
that those are the things I really enjoy
How did
at
motherhood
this point.
affect your work, your career?
Well, I think that, having my daughter in my life really helped me to work harder on that balance, right? And also it gave me a special appreciation for my own mom and my aunts, and in how they balanced work and raising children.
What is one thing looking at your daughter allows you to see in your mom or even one of your grandmothers?
Love and joy.
God,
Yeah.
I love that answer.
Love and joy, yeah.
If a year from now we were sitting here celebrating what a great year it's been for you as a mother, psychologist, and a businesswoman,
Right.
what would we be celebrating for you?
That I've achieved the balance we talked about, and that I'm still sharing what I'm learning along the way, that I continue to share that with other people.
I like that.
Yeah.
Can you tell us about how spirituality influenced your work, if it does?
Mm-hmm. Absolutely. I was raised Catholic, and so there's a strong sense of Catholicism in Guyana. I saw, my experience of it was, I enjoyed going to church because of the community and the music, fellowshipping with people in church directly, but what I saw also, my experience of Catholicism in Guyana when I was growing up, was a strong sense of practicing social justice, so that when you saw things wrong in the community, you get involved, and you just don't stay in your community only. You go out and you ask how you can help, and you find ways to help. So although I'm not fully practicing, I continue to remember those lessons of when you notice something wrong in the community, you ask how you can help, and you get involved in helping.
When are you most happy?
Probably when I am in the sun and reading a good book.
What are you most thankful for?
My relationships, my connections with my family, with my husband, with my daughter.
When you think back on the long arc of your career, what would you say you got right and you got wrong?
What I would say I got wrong is, spending so much time in the research world, maybe.
Mhm.
Although, I would say that I got a lot of great lessons in how to take what we're learning in research and bring it into the therapy room. What I would say I got right is go back to that class, Psychology of Women, with Dr. Romer, that I got right what I am meant to be doing, that I am meant to be helping people who've experienced significant trauma reconnect, continue to enjoy life, and enjoy that entitlement that we all have.
If you could go back in time,
Yes.
what would you tell your 15-year-old self?
Look out, it's going to be a lot of work. But the thing I wouldn't change is, really my connections with people. I have friends that I've had since I was 10 years old that I still am very good friends with. So
Awesome.
That's something that I wouldn't change.
And this is my last question of the evening.
Yes.
What makes you laugh out loud?
That question. Well, so many things. I really enjoy, like, my favorite style of movies is really comedies, right?
Okay.
So people who can laugh at themselves and also create a way for us to laugh. Yeah.
I like that.
Yeah.
Dr. Caldeira, thank you so very, very much for spending this time with us. It has been a pleasure.
Oh, thank you so much. I'm really happy that you invited me here. And I, like we talked about, I was a little nervous.
Yes, I know it's gone.
And now, right.
Now you're laughing out loud, right?
Exactly. Thanks so much.
Wow. And so, to the audience, thank you for tuning in once again. Thank you very much. And please tune in tomorrow evening for Mr. Ted Gustus. But tune in same time from 8:30 p.m. So this is Selwyn Collins saying, fear not what fear whispers to you. Fear your obedience to it. Good night.